The rhythm of physiotherapy evolution. What is physiotherapy? Journey to the history. Physiotherapy today. Physiotherapy tomorrow. What is physiotherapy? Physiotherapy is a health profession with expertise in human function and movements, and maximizing physical potential throughout the lifespan across the health spectrum, which concerned with maximizing quality of life through movement potential within the health spheres of promotion, prevention, treatment, intervention, habilitation, and rehabilitation. Physiotherapy is a scientific approach which includes physical well-being, psychological well-being, and social well-being by promoting, maintaining, and restoring. Journey to physiotherapy. The first practice takes us to 460 BC, where physicians like Hippocrates, and later Galenus, practiced using massage, manual therapy, and hydrotherapy. Certain records have been discovered that, in ancient China, trained doctors practice technique of therapeutic exercises and massage. The book Kung Fu 3000 BC describes the active, passive, and combined exercises and massage. In ancient India, yogis used breathing exercises to prevent and cure diseases. Ancient Egyptian doctors were struggling with rheumatism with physical exercise, massage, diet, hydroprocedure. In ancient Rome, therapeutic exercises were developed. The book Oribazza 360 AD describes almost all the materials of the time, with remedial gymnastics play a full book. Origin of using currents to relieve pain goes back to 250 AD, where goldfish electric fish was used to treat gout and headaches. Convincing his aphorism, "The movement, the best treatment for the body," German Dr. F. Hoffmann published The Art of Gymnastics, which expressed the significance of rubbing, diet, massage, physiotherapy, etc. In 1864, the Swede T. Brandt developed a system of therapeutic exercise and massage to treat patients with gynecological diseases. In 1884, Schott developed exercises for heart patients, which was based on resistance exercises. In 1889, a Swiss doctor Frenkel proposed a set of compensatory gymnastics for the treatment of ataxia, paralysis, paresis, and other diseases of the nervous system. After the development of orthopedics in the 18th century, machines like the gymnasticon were developed to treat gout and similar diseases by the systematic exercise of the joints, similar to later developments in physiotherapy. Initiation of modern physical therapy at the end of the 19th century. Another landmark in the physiotherapy was during the breakout of the polio epidemic. These physiotherapists did groundbreaking work in the rehabilitation and treatment of the polio patient. Institutionalizing physical therapy during the First World War, to restore physical functions in soldiers. Publishing the first physical therapy research, the PT Review, United States in 1921. During the Second World War at its peak, physiotherapists mainly contributed to recover soldiers who returned home with amputations, burns, cold injuries, wounds, fractures, and nerve and spinal cord injuries. In 1950, the focus on joints and use of manipulation started gaining popularity. In the late 1950s, physical therapists started to move beyond hospital-based practice to outpatient orthopedic clinics, public schools, colleges, universities, health centers, geriatric settings, skilled nursing facilities, rehabilitation centers and medical centers. In 1951, the World Confederation for Physical Therapy (WCPT) was established. In 1974, physical therapy specialization occurred in the United States are some of the greatest milestones in the evolution of physiotherapy. With years passing, new innovations, technique and procedures, the capability of the craft that physiotherapists use to treat their patients keep getting better every day. Physiotherapy today. Today's physiotherapy is an independent healthcare profession, which approach to help humans of all age groups in all aspects of health and well-being. As the autonomous health professionals who have extensive knowledge of the body and its movements, they determine strategies for diagnosis and do interventions to treat. Physiotherapists are qualified and professionally required to undertake a comprehensive examination, assessment of the patient, client or needs of a client group. Evaluate the findings from the examination, assessment to make clinical judgments regarding patients, clients. Formulate a diagnosis, prognosis and plan. Provide consultation within their expertise and determine when patients, clients need to be referred to another professional. Implement a physical therapist intervention treatment program. Determine the outcomes of any interventions, treatments. Make recommendations for self-management. The wide scope of physiotherapy includes musculoskeletal, orthopedic, cardiopulmonary, neurology, pediatrics, sports medicine, rheumatology, older people, geriatrics, medical conditions, women's health, oncology, public health and many more. Physiotherapy tomorrow. Australian Physiotherapy Council celebrated their 50th anniversary in 2019 by leaping ahead to the next 50 years of future. We are so sure the magic of the new beginning in the near future will take your breath away. By 2040, human will come with their own, unique, constantly updated, instruction manuals for the whole body, with personal X-ray, MRI etc. which physiotherapists will use to plan, perform and benchmark treatments for them. By 2045, a paradigmatic shift that will truly move physio intervention to become proactive and preemptive by identifying and preventing disease before it even presents in the first place. By 2050, physiotherapists will be working inside the patient's body, as well as outside. Isn't that fascinating? So, be ready for the marvelous evolution of physiotherapy.